Hey, it's Dr. Birchler here at the Chiropractic Health Center, and we're in January right now, and this is the peak season for bad weather here in Pennsylvania, and with bad weather comes ice, vehicle accidents, and those kind of things. And one of the points that I always end up discussing with patients every year this kind of thing comes up is a common scenario. Somebody has some level of a crash, accident, or injury, and commonly, if they have any pain or things like that, they'll go to the hospital, to the ER, especially if there's police are called to the scene and the person has symptoms. They go there, and that's all fine. I'm not suggesting that there's no reason to do that. Sometimes there's probably not, but the point of that system, emergency medicine, when you go there, oftentimes there's quite high expense, and they're doing some things that are looking at, did you have a head trauma that's causing your brain to bleed internally, so you can't see it on the outside, but could be a potentially serious thing, possibly need to have some type of surgical intervention or something like that to deal with the brain trauma, the swelling, and some of the things that can happen as far as damage from that. The other thing they commonly would be looking for is a series of x-rays or CT scan to see, are there any fractures, in particular a fracture in the upper neck that could cause an instability in the spine, allowing things to shift and damage your spinal cord. So things that would be life-altering, causing paralysis or something, and things that may be difficult to see on x-ray, so sometimes they'll use a CT scan to be able to see the bones better, just a different type of imaging for that. So they're looking for these things that are internal, can't see from the outside, and may have a surgical type of intervention needed, or at least considered if they're present, right? They're also looking, are there dislocations in the vertebrae, a medical subluxation or a type of dislocation of the spine from the trauma. Possibly checking for some indications of brain swelling, and did the person have a concussion as well. So those are all good things, especially the more serious the impact, the more probable those things could become. My point to people is let's say you have some level of crash and you go and get all these things done, and you don't have any fracture, you don't have any dislocation, you don't have any bleeding on your brain. And so they end up saying something like all the tests were negative, and say something to the effect of like you're okay, or people get the impression that there was nothing wrong. And that's not really a correct impression. It's just that those things they were looking for weren't present. You may have all kinds of let's say misalignment. The spine may be off mechanically. You may have a person move and they can't move correctly. That person may have headaches, that person may have neurological symptoms, that person may have pain, they may have soft tissue damage in the neck, they may have disc herniations that aren't present on those tests just mentioned, and MRIs are not a routine test, and those are the things where you can really see a disc injury. So my point is that people very often get these things done, go to the ER medical realm, and then end up with the impression that they didn't find anything wrong, and so they didn't need to do anything about it. But understand, that's really just looking as this person needs surgery. Chiropractic really looks at it from a whole different standpoint. It's like all the stuff that's not surgery, but is going to affect your life both now and many years into the future, and the decay of the spine and everything that happens, the arthritic change that will happen down the road. And it may happen to some degree anyway from the trauma, but it can at least be minimized by correcting what can be corrected. That's really the realm that chiropractic looks at, and that's the huge majority of people have some level of that. Very few people have the things they need to cut you open and drain blood off your brain, or hook your bones back together if your vertebrae are fractured or something like that. That's a tiny percentage of people. Huge percentage of people have various levels of spine and muscular system and ligament trauma that could benefit from chiropractic. So my point in saying this is, if you have a vehicle accident, you have any level of symptoms, pain, things like that, chiropractic should just be a standard check. It's a separate, different thing from any of that stuff that happens in the medical realm. So don't get the impression that that's like a complete evaluation and there's nothing wrong if they don't find something on those type of tests. Okay, if you have this situation personally, you're in our area, we're certainly happy to talk with you, answer questions, see what's going on in your case, and try to help you. Thanks for watching. Hope this helps.